Nancy Reagan, our former First Lady, took care of President Reagan, who had Alzheimer's disease. And Nancy Reagan is probably the first public figure that really talked openly about her struggle with caregiving and taking care of a husband who had Alzheimer's disease. And she gave a lot of interviews, and she did so much good for Alzheimer's awareness. But one of the things that she said stuck with a lot of people. And she said something along the lines of, "We will never move him out of home. We will never consider moving him to a nursing home or assisted living, anything like that. He will stay at home." And stay in their Bel Air home until he died, he did. But she had some advantages that I'm guessing a lot of us here don't have. And you might be thinking, I'm talking about money. Okay, let's say you are also extremely wealthy. Great. Maybe you can afford to have lots of care in the home, but President Reagan had something that I guarantee no one in this room had. Anybody? Secret Service. If President Reagan was wandering out of the house, who do you think stopped him? And he didn't have to get into a fight. His wife didn't have to redirect and say, "Oh, Ronnie, come on, it's time to go do arts and crafts." The Secret Service were there. So they had a lot of financial resources, and not only did they have the Secret Service, but they actually had docs and nurses in the home, not just a home care agency. They had lots of resources. Most of us don't have that luxury, so we always have to be open to course correcting. If things are going beautifully with your caregiving plan for your loved one with dementia today, wonderful. But just know that, like a ship out on the water, you may need to course correct at some point. It might get to the point where in 3 months or 3 years, you have to choose to do something a little bit differently.